Burns are one of the most devastating and complex forms of trauma a person can go through. Today, we're going to go beyond the flames to really understand what happens to the body during a severe burn, and more importantly, how medical teams fight back in those critical first hours. So here's how we're going to break it all down. First, we'll look at how medics even begin to size up the damage. Then, we'll dive into the incredible shockwave a bad burn sends through the entire body. We'll also unpack the hidden danger of smoke inhalation. And finally, we'll walk through the immediate response and the long, long road to recovery. Okay, so first things first. To even begin to treat a burn, you have to understand its scale. And really, it all comes down to two key factors. How deep is it, and how much of the body does it actually cover? And this distinction right here, it's everything. Is it a partial thickness burn, meaning it hasn't gone through all the layers of the skin? Or are we talking about a full thickness burn, which has destroyed the skin completely, right down to the fatty tissue underneath? Just answering that one question, how deep, can completely change the entire plan and the patient's future. Okay, so that's the depth. The other big piece of the puzzle is the total body surface area, or BSA, that's been burned. Now, in the chaos of an emergency, you don't have time for precise measurements. So medics use this really clever mental shortcut called the rule of nines. It breaks the body into sections of roughly 9%, giving them a fast, pretty reliable estimate of the burn size, which is absolutely crucial for what comes next. Now, this is where things get really intense. Once you know the scale of the burn, especially a severe one that covers more than a quarter of the body, you realize pretty quickly this isn't just a skin injury. No, it's the trigger for a systemic shockwave, a crisis that puts the entire body on red alert. What happens is the burn basically sounds this massive, body-wide alarm. All over the body, the tiniest blood vessels, the capillaries, suddenly become super leaky, almost like a garden hose full of holes. They just start pouring vital fluids and proteins out of the bloodstream. This sets off a terrifying cascade. The heart struggles to pump, blood flow gets choked off to the limbs and gut, metabolism skyrockets, and the immune system just gets hammered. So, what does all this add up to? Well, it leads to a state called burn shock. It's a life-threatening condition where the body is losing so much fluid that its entire circulatory system starts to fail. For any emergency team, stopping this is priority number one. But here's the thing. The damage you can see from the flames, that's often not the deadliest part. The greatest threat is frequently invisible, hiding in the smoke the person breathed in.
Yeah, and it's way more common than you might think. We're talking up to a third of all patients who are admitted with serious burns have also suffered a direct injury to their airway from breathing in all that hot gas and toxic smoke.
Which, of course, brings up a really scary question. Just how much does this invisible injury actually affect a patient's chances of survival? And the answer, it's just staggering. I mean, look at this. An estimated 3 out of every 4 deaths after a major burn are directly linked to a compounding inhalation injury. It is the single biggest factor that can make a survivable injury a fatal one. So how does smoke do so much damage? Well, it's basically a 3-pronged attack. First, you've got direct thermal injury from breathing in superheated gas. Second, there's chemical injury, where all the toxic stuff from what was burning damages the delicate lung tissue. And third, there's systemic poisoning from gases like carbon monoxide and cyanide, which get into the blood and literally stop the body's cells from using oxygen. Okay, so knowing all that, the shock, the poisons, the hidden damage, how do medical teams even begin to fight back? It all starts in that first critical hour with a phase of care called resuscitation. Well, they're trained to be detectives. They're looking for these telltale clues that point to a dangerous internal injury. Things like burns on the face, singed nasal hairs, soot in their saliva, or a hoarse voice. They're all major red flags. And anyone rescued from a fire in an enclosed space is automatically considered at extremely high risk. The response has to be immediate, and it follows a very clear protocol. The absolute top priorities are flooding the patient with high-concentration oxygen and getting IVs started to pour fluids back in. And we're talking a massive amount, up to 10 liters in the first 24 hours. I mean, that's like pouring 5 giant soda bottles directly back into their body. At the same time, they're covering the patient to stop heat loss and trying to manage the incredible pain. Now, here's a really specific and frankly terrifying situation. When a full-thickness burn goes all the way around the chest, the charred, dead tissue, it's called eschar, it becomes tight and hard, like a horrible straitjacket. It can literally stop the lungs from expanding, So doctors perform an eschorotomy, which is a surgical cut through that dead tissue, to relieve the pressure and simply allow the patient to breathe again. It's a life-saving procedure. And this is something that's so important to remember. Unlike the burn on the skin, the damage to the airway isn't always obvious right away. The swelling can actually get worse and worse over several hours. That's why constant reevaluation of the patient's breathing is absolutely key. And for those invisible killers, the poisons in the smoke, doctors have specific antidotes at the ready. For severe carbon monoxide poisoning, that often means hyperbaric oxygen therapy. And if they suspect cyanide poisoning, which they can guess based on high lactate levels in the blood, they immediately give an antidote called hydroxycobalamin. But that initial resuscitation, as intense as it is, it's really just the beginning of what is often a long, grueling journey back to health. Experts have a framework for it, which they call the 4 Rs. And this timeline really gives you a sense of that whole journey. After that initial resuscitation phase, you move to resurfacing. That's all the complex wound care and skin grafts. Then comes intensive rehabilitation to get function back. And finally, often years down the line, reconstruction surgeries. This entire marathon is managed in specialized burn centers. And even after that first life or death crisis has passed, the patient's airway remains this constant battleground. Many patients need a breathing tube for a long time. But with all the facial swelling, just securing that tube is a huge challenge. And if it accidentally comes out, it can be a catastrophe. All while this is happening, their airway needs constant clearing, and the many surgeries for skin grafts often mean they can't be weaned off the ventilator for a long time. Which really brings us to a final thought about the future. A severe burn is one of the most complex injuries you can imagine, pulling in expertise from almost every single field of medicine. It makes you wonder, as we move forward, what breakthroughs in things like tissue engineering or controlling the immune response will one day completely redefine this incredibly difficult road to recovery and offer new hope for survivors?